The cases keep coming. Ohio passes the 6,000 mark for the first time with 6,508 new coronavirus cases reported today. It is our single biggest day increase and an alarming new high.
Our 3-week daily average now stands at 3,612 cases per day. For perspective, a month ago, Ohio reported 1,356 cases. Today's number is more than 4 times that. Something then State Health Director Dr. Amy Acton warned us about back in March.
Not if, but when. We will surge. At our peak surge, we may be as high as 6,000 to 8,000 new cases a day.
And thanks for being with us tonight. I'm Russ Mitchell.
And I'm Sarah Shookman. This is a pattern we are seeing across the U.S. as the country just surpassed 1 million new cases in just the first 10 days of November. The odds are at this point that you have been impacted by COVID-19 either directly or indirectly. And tonight, health officials say there's still a lot of confusion about what to do when dealing with a positive case. Lynna Lai spoke to health experts about the most frequent questions and has the answers.
Questions about what to do in the face of a positive COVID test have county health departments busy giving guidance.
Businesses that have sick employees, wondering what they need to do and how to.
In Lake County, new October data showing workplaces were a source of spread. Workers taking masks off to eat lunch, but not socially distant from their colleagues. And when someone tests positive, they're told to isolate for at least 10 days. As for their close contacts, defined by those who've been within 6 feet for a total of 15 minutes or longer in a 24-hour period. Close contacts should quarantine for 14 days. Others who came in contact with close contacts do not need to quarantine since they are at low risk.
Usually we would just say that just monitor your symptoms, and just be careful.
Which brings up another common question. Why do positive cases isolate for 10 days while their close contacts have to quarantine for longer, 14 days?
If you're in isolation, we know you have the disease.
The CDC considers you disease-free after 10 days and no fever without medicine for 24 hours. For close contacts,
Any time during those 14 days, you could become ill with the disease. It's hard for people to understand that if you have the disease, your time can be shorter. But actually, it's just based on how we know you could break with the disease any time during those 14 days.
employers are not advised to require a recovered worker to test negative before returning to work, since you could still harbor traces of the virus for as long as 90 days. So after a 10-day isolation,
You have still virus remnants, but you are not contagious.
now, health departments once again urging mask wearing and avoid social gatherings. The Lake County Health Department tonight saying most recently, one young person did not quarantine when they were supposed to, went to a Halloween party. More than 60 people had to be quarantined. 9 positive COVID cases from that one mistake, Sarah.
You see just how fast these dominoes fall. All right, Lena, thanks.